Meeting to order now, and this is the public session of the Global Health Committee. I want to welcome all of you. Especially I want to thank all of the sponsors. The sponsors of the study include USAID, CDC, FDA, NIH, DOD, PEPFAR, Rockefeller Foundation, Merck Foundation, Medtronic, and BD. So thank you very much for your attendance and for your support of this study. Before we start, we have to do some formalities. I need to read the disclaimer for an open session, so I'll do that now. As a co-chair of this study and of this committee meeting, I've been asked to let everyone know that this is an open, on-the-record information gathering session. The committee is in the process of collecting information and materials it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone to be mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or the national academies. In addition, committee members typically ask probing questions in these information gathering sessions, which may not be indicative of their personal views. This is the first of 4 planned committee meetings. The second meeting in early December will also include a public session where we'll have the opportunity to hear from more experts in the field and receive public testimony. The committee will deliberate thoroughly before writing its draft report, planned for release in April 2017. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee then must respond to this review with appropriate revisions that adequately satisfy the Academies Report Review Committee and the NAS President before it is considered an official Academies report. I would also like to give some sense of the format of today's meeting. We'll first have a chance to hear from some of the sponsors on their priorities for this study and areas of focus within the statement of task. Following discussion and a short break, we'll hear additional background and context of 3 key areas of global health programs within the U.S. government, namely non-communicable diseases, global health security, and maternal and child health via non-governmental analysis and projects. Before adjourning, we'll have time for public input from anyone present who would like to add any comments. And so again, let me welcome the sponsors and also the public that's come to participate in the deliberations this afternoon. The committee is being asked to examine several factors. One is how responsiveness and efficiency can be improved related to external leadership and internal coordination within the U.S. government. Also, how has the current global health landscape evolved in the last 8 years since the last committee reports, one issued in 1997 and the other one, the latest, in 2009. And to consider this within the context of the changing global health landscape to include issues of infectious and non-communicable diseases, antimicrobial resistance, the initiation of the Sustainable Development Goals, commitments to an AIDS-free generation, universal health coverage, and other global health issues. I would like to remind the audience before we start the deliberations that in the interest of time, I ask speakers to introduce themselves by name, title, and affiliation. But more detailed speaker biographies of our sponsors are available in the meeting materials. During the Q&A sessions and the discussion, the committee's questions and comments will take priority. If there is time remaining, questions and comments may be taken from the audience. The meeting is being recorded. Available speaker presentations and video will be posted to the project website soon after the meeting. And finally, further information on the study, including future meetings, can be found on the project website. Before we start with our sponsors, I will ask the committee members to briefly introduce yourselves, just very briefly describe your background in general, and affiliations today. We will start with myself. I'm the co-chair of the committee. I'm Jendayi Frazer. I'm an adjunct senior fellow at the Council on Foreign Relations and have done work through my role in government and also in the private sector.
My name is Gisla Abam. I'm the Global Executive Director for Government Affairs and Policy with GE Healthcare. I also chair the Global Diagnostic Imaging, Healthcare IT and Radiation Therapy Trade Association, working closely with WHO, the World Bank, and governments across the globe. Thank you.
I'm Peter Lamte. I'm President Emeritus at FHI 360 and Professor of Non-Communicable Disease at the London School of Hygiene and Tropical Medicine. I'm based in Ghana, and over the last 40 years, I've worked in maternal and child health and family planning, HIV, and now NCDs. Thank you.
Hello, my name is Linda Chin. I'm currently the Chief Innovation Office and Director of the Institute for Health Transformation at the University of Texas System. My background is a dermatologist with 18 years academic research in cancer genomics, being involved in the national and the international project on genomics. And over the last 4 or 5 years, transitioned and became really interested in how technology, data, and analytics, as well as public-private partnership can be bring to bear to change our healthcare delivery system. And that's where I become totally focused on at this point.
I'm Mike Merson. I'm at Duke University. I direct the Duke Global Health Institute, and I'm Vice President and Vice Provost for Global Affairs. Prior to that, I was the Dean of the School of Public Health at Yale University, and prior to that, worked 17 years at the World Health Organization, running the global program on AIDS, which was the predecessor to UN AIDS, and the diarrheal disease control program.
Hello, I'm Stephanie Ferguson, and I'm Consulting Associate Professor for Stanford University. My background is in human resources for health, health system strengthening, universal health coverage for the World Health Organization, all the regional offices.
Good afternoon. My name is Juan Carlos Puyana. I'm a professor of surgery and clinical translational science at the University of Pittsburgh. I'm a half-time busy clinical trauma surgeon. And over the last 16 years, I've worked in Latin America, past president of the Pan American Trauma Society, and traveled all over Latin American trauma hospitals, taking care of emergency surgeries and talking to people about injuries. Thank you.
Good afternoon. I'm Amy Batson. I'm the Chief Strategy Officer, VP of Learning at PATH, an NGO focused on global health innovations. Prior to that, I was 3 years at USAID as a political appointee in the Global Health Bureau, and prior to that, 14 years at the World Bank, and then before that, WHO.
Thank you very much. Before I turn it over to the panelists, and I'll ask you also to introduce yourselves and take 15 minutes to give us our charge, and we'll start with Ariel. The committee...
Elaine, excuse me.
Oh, sorry.
I just wanted to introduce myself. That's okay. My name is Leah Fernald. I'm a professor at UC Berkeley in the School of Public Health. My area of focus is public health nutrition and maternal and child health. And I have current large-scale randomized controlled trials underway now in Madagascar, Malawi, Mexico, India, Kenya, and Bangladesh.
Thank you. Skip, are you there?
And I'm a retired professor now, a senior fellow and scientist at the Harvard Humanitarian Initiative, Harvard University and School of Public Health, and also a senior international public policy scholar at the Woodrow Wilson Center. I've practiced some form of global health all my life. Thank you.
And my co-chair, Valentin, will be coming in. His plane was delayed, but he will be here soon. Before I turn it over to our sponsors, the committee in its deliberation this morning had 3 questions that we wanted to put to you to help us really focus on our charge. And if I could just give you those questions, and then you can introduce yourselves and maybe give us some sense of how you see these issues, or as well as the presentation that you came with. And given that the committee's the title of our committee is the Committee on Global Health and the Future of the United States. We were very interested in how you want us to focus versus an internally focused versus an externally focused for the U.S. Because it says global health and the future of the United States. So how are we to focus our study? Secondly, the questions coming out of that are, how do you believe we can better improve the responsiveness and efficiency of the U.S. government? This was part of our task of work, and we really have honed in on this and wanted to get your guidance on what aspects of internal coordination, responsiveness, and efficiency from your own experience, or where you see gaps that we could address. And then finally, what are the priority factors, the 3 or 4 factors that you think should shape the USG global health agenda over the next 3 to 4 years? And we really want to get the benefit of your experience and your expertise on these 3 areas so that we can really carry out the task of focusing a study that will have impact and that will have practical benefit to the sponsors themselves. And so with that, let me turn to Ariel, and we'll just go right around. If you can just introduce yourself, take 15 minutes, maybe, and hopefully address the 3 questions that we asked you.